Good afternoon, Victoria. Today's press briefing is available to view or watch live on KAVU, KIX 108, and Magic 95.9. Before we begin, I want to inform you that the CDC, Center for Disease Control, now recommends wearing cloth face coverings in public gatherings where public settings, where 6-foot social distancing may be difficult to maintain. For example, this could be when you take an essential trip to get your groceries from a grocery store, or if you're working as an essential employee and other public setting scenarios. That being said, cloth face coverings are not a replacement for the existing social distancing requirements. Victoria residents still must abide by the Stay Safe, Stay Home local order and practice proper hygiene. Wearing a cloth face covering will help slow the spread of COVID-19 in our community and help those who may have it and may not know that they do from transmitting it to others. One of the primary ways that this virus spreads is through respiratory droplets produced when an infected person coughs, sneezes, or talks. The CDC website will show you how to make these facial coverings, including using materials that you may already have at home, such as a t-shirt. The Surgeon General also recently released a how-to video that also can be found at the CDC's website at www.cdc.gov. Dr. McNeil will elaborate on this exact topic more shortly. Now, I'd like to move on to the current COVID situation in our community. As of 2:30 p.m., we have 9 new cases, 4 of which were attributed to Pam North. The rest are currently under investigation. Total cases in Victoria County brings it to 50. Suspected community transmission is 9. Those who have since recovered is 6. And that leaves us with currently active COVID cases in Victoria County at 43. Today, we will have our Victoria Public Health Authority and our city attorney discuss COVID-19 in Victoria County, the new cloth face covering recommendation, and Hipaa laws that protect patients' privacy. For local information regarding COVID, please visit victoriatxoem.org or call our COVID hotline at 361-580-5796. At this time, I will now welcome into the room our Public Health Authority, Dr. John McNeil, and our City of Victoria City Attorney, Thomas Gush.
Good afternoon, Dr. John McNeil. I'm the local health authority, and for those of y'all just tuning in, they want me to repeat the information that we've been talking about. We have a total of 9 new cases today to report. That brings our total cases in Victoria County up to 50. Suspected community transmission is still an issue. We have 9 patients that we're considering to be community transmitted. We've got that marked at mild to moderate, and we'll continue at that mark, watching it very closely. We have 6 patients that very nicely have recovered from this disease, as we would expect. And that brings us to a total of 43 active cases. Now remember that we are now reporting the post-acute medical outbreak, and we are continuing to watch that very closely. They have been aggressively testing patients, and we'll talk about that later. Their total number is 29, 20 of which of those are healthcare workers, and 9 that are patients in their facility. All of those 29 are included in our total, but if you do the math and the numbers aren't right, it's because we only report the patients that are in Victoria County. So the numbers may not add up because there are like 8 other patients that are here in Victoria that we've diagnosed, but actually live in other counties, so they go on as far as that community goes. Other than the raw numbers, that's one of the questions that's come up a lot, is why are we not answering, or why are we not providing more information as to these patients, more specifically, like where have they been, where have they traveled, what have they done, things like that. We're very careful about that because of the Hipaa violations and the Hipaa Privacy Act. And fortunately, we have an attorney here today. Thomas is going to talk about that in just a little bit. I was very happy to know that. One of the things that I do want to talk about today, though, is that there's some new CDC guidelines out there. And the CDC is ever-changing things. And we're going to pretty much reverse what we told you a while back. At one point, we told you that the public wearing face masks was not necessarily the thing to do. That has all changed, and that just shows you how fluid this situation is. The federal government and the Centers for Disease Control, our president and everybody else has now recommended that we wear face masks. So we'll talk about that. Now, one of the things that I want to tell you is that I think face masks or a facial covering. I'm going to say face masks today because I've been calling them face masks for the last 40 years or 35 years or so. Now I'm going to call them facial covering because the things that the general public are going to wear may not be specific masks. We want to cover your mouth and nose. That's what we want to do. And we want to protect everyone. And you may think that if your mask is not sealed, and if it's not sealed well around your nose like the commercial masks do or the commercial facial coverings do, that it's not working. But the idea here is that we want to basically protect everyone from you, and we want to have them protect themselves from you getting sick as well. So it's a deal to where pretty much everybody wears a mask, and that's what we're recommending. I'm now saying that the recommendations, and we've spoken about this at length, the recommendations that we're putting out today are that everyone that goes out of their house should have facial covering, whether that be a commercial mask or something made. I've got some examples here. As my 6-year-olds would say, it's Daddy's doing show and tell today. So the one that I wore in is a simple surgical mask. This is a surgical mask. I see a lot of people around here wearing them. Work good, but this is a limited supply. So what people have done is they've come up with other facial coverings. This one right here, this was made by some sweet person that I don't know who it was, or I would say her name, but one of my office staff had one of her friends sew this at home, and we're seeing this everywhere. People are really getting on board and doing this. This is a great deal. I'm not going to put it on, but this just covers your mouth and nose, okay? This should be worn. This will be fine for general use. The other thing that comes up a lot is, and people have asked me a lot, so I'm going to go ahead and talk about it, are N95 masks. N95 masks are the ones that are worn by healthcare professionals because they offer a better filtration and usually a better seal. These are actually fitted to the person, the healthcare worker's face. And these are what healthcare workers will wear in sensitive environments. Like if they're doing a procedure on a patient in their airway or doing suctioning or giving a breathing treatment or something that happens every day in the hospitals. This is what an N95 mask is, okay? This is another version of an N95 mask that goes on the same way, basically different filters, okay? So there's a lot of different masks available. There's a lot of different ways of accomplishing the same goal. And folks, the goal is just to basically use the one thing that we have to protect ourselves and to protect our community, and that is covering your mouth and nose. So we know that this is a respiratory pathogen. We know that this virus infiltrates the body in most cases by going through your nose and through your mouth. So we think that we can help. So we're asking that everyone wear a mask everywhere you go. And it doesn't have to be a fancy medical mask. It doesn't have to be an N95 mask. It can just be a simple face covering, okay? I've heard of people that are even using bandanas and things like this, and I'm sure that in the next couple of weeks we're going to see some pretty inventive type of facial coverings used. Remember, that's our best defense to slow the spread of this virus. Now, one thing, a take-home message from what I've just said. This is not a substitute for social distancing. This is not a substitute. Social distancing is still our best defense against this virus. We still believe, and I hope this doesn't change, but we still believe that keeping people 6 feet away from each other is the way to do it. So we're going to do that. We're going to continue to do that. Now, I've had people even ask, well, if I wear my mask, can I have all my friends over the house? No, that's not the way it works. And I say that because we will get asked that. So keep the social distancing, avoid crowds, don't go places you don't have to, and please stay home and stay safe, okay? All right, a couple other little things I want to go through here. We need to discuss community testing. There's a lot of questions out, and remember that the issues that we come up with to talk about are based on on questions. And there's a lot of questions about testing, and everybody wants to be tested. I get that. But we have to understand that we do not have the capability of testing every American. And we try not to, and we're going to continue for the near future, as far as I can see, to not test people that don't need to be tested. In other words, we need to save those tests because they're precious resources. The Centers for Disease Control has come up with a sheet here that talks about the priorities of testing patients with suspected COVID-19 infections. They have priority 1, priority 2, and priority 3. Priority 1, I'm not going to read them to you, but they're hospitalized patients, and they're patients that are acutely ill that we need to know because we need to be able to isolate those patients from other patients. The second ones are healthcare workers and people that provide care to those patients. Because you think about it, if you have a patient in a room, they're isolated. If you have a healthcare worker that has 5 or 6 patients on that floor, that's a person that's going from room to room to room. And you can certainly see that the spread of the transmission of this virus is much more likely in the second group. So we're very careful about that. We have separate priorities. So when we test people, we base our testing on this, and we do this to save that precious resource. We have to be very judicious in what we do as far as testing goes. So if by chance you think you're sick and you have symptoms, you need to speak to your healthcare provider just like before, and then a decision will be made. But I can tell you that not everyone needs to be tested, and not everyone can be tested. There will come a time, and there are some areas already that actually are having trouble testing the people that they need to test. And I can tell you that in Victoria, the number of tests that we have is going down. So we have to be very careful about that, and that's why you'll see this happening. I think the last topic that I have, well, that was the last topic. So I'm going to turn this over to our city attorney, and he's going to talk about Hipaa, and he's going to talk about why we're so careful to make sure that we don't violate anybody's privacy rights, and then we'll be here to answer questions. Thank you. Thomas.
Thank you. Good afternoon. My name is Thomas Gush. I'm the city attorney. We've been consistently saying in these press conferences that we're going to be as transparent as we can about the current state of COVID-19 in our community, but some people have still asked why we're not releasing more information about the patients or the people who are being tested, such as where they live, where they work, or even what their names are. I'd like to answer that question today just by reminding everyone about the privacy rights of those patients. Federal law, through the Hipaa privacy rule, protects what's known as individually identifiable health information. That is, any information that reasonably might identify an individual and also includes past, present, or future physical or mental health or condition. So that would be testing or confirmation of any disease, or the provision of health care to that individual, which would include medical treatment of any disease. And so in the context of COVID-19, if we're up here discussing tests, confirmations, or treatments, we're prohibited by law from releasing information that might also identify an individual or their relatives, their household members, or even their employers. The health department is directly contacting people who've been exposed to the virus, so there's no need for us to be sharing that information publicly. In order for us to continue to comply with federal law, we're going to continue to protect those patients' confidentiality while we strive to release as much information we can that the public is looking for. And we thank you for your understanding. And now I'll open it up for any questions.
So the CDC is asking us now to wear face masks, and so that obviously was not the case 2 or 3 weeks ago. What measures or preventative measures are countries like China that were affected before us, what are they doing now that we aren't doing? Were they wearing face masks months ago or weeks ago? Or how does that work?
Well, initially, if you look back, and the only thing I can go by is the news stuff that I've seen, and initially it was kind of hit and miss, and some people were wearing masks, and if you looked around the United States, it was kind of that way too. It just seems like a good idea, but in the beginning, I think that the thought from the Centers for Disease Control and the experts was that it was possibly not going to get to the point that it is now. We're talking about this, and probably the biggest reason for this change is the increasing concern for asymptomatic transmission. And what we're talking about is that there are a lot of studies out there now that are identifying patients that we know transmitted this disease without having any signs or symptoms. So if you have a patient that is not sick and we're telling them you can go to work unless you're sick, then perhaps they were transmitting that virus at the time. So we do know that patients without symptoms can shed virus, and thus these may be the patients that are causing a lot of this spread. It's hard to know, but we do know that it's a respiratory pathogen. So the idea of having a mask on just makes sense, and that's why we're doing it. I think it's a game changer, and I think it's something that we should do. But that wasn't what we thought in the beginning, and we always go by. I'm not blaming the Centers for Disease Control. We just do what we're told as far as from the experts. Well, now the experts say it'd be a good idea, and that's what we're going to do.
Was that something that they could have picked up on earlier from say other countries or?
I'm not sure that other countries were doing it as much in the beginning, because I think worldwide, and a lot of this information is certainly shared. So it just seems like it's the thing to do now, and I think it's a game changer, and I absolutely think it's the best thing we can do.
Dr. McNeil, just a couple of quick questions about PAM. There's 9 patients affected, you said. Were they all inpatients or receiving inpatient treatment, or was it a mix?
The 9 patients that I have were part of the 20 patients that were tested that came back positive. And the question was how many patients from PAM that were inpatient, I believe is what you're talking about.
Yeah, were they all inpatients, or were some of them, there for outpatient services?
These were inpatients that were tested, and all those patients have been tested.
Okay. And so you said of the 26 beds, 20 are full. There's 20 patients there right now?
That's the information I was given.
Okay.
I know that they tested 20 patients, and they've followed everything we've asked them to do, and we asked them to test all those patients.
Okay. And I believe, I can't remember what you said our number of community transmission was, but does it match the PAM number? Are we considering those person-to-person spread, or how do we classify PAM?
Well, remember, we consider community transmission when we don't have a source.
Okay.
So basically, there was an outbreak in that facility, so that is the source. So we know that those patients acquired that illness simply because they didn't go anywhere else. We know that that was not community transmission. We know that that was basically, we could define where it came from.
Okay. And you said all patients have been tested. What about staff members at PAM? I know that many had been tested on Friday. Just wanted to check in on that.
They have aggressively. The question was, are all staff members at PAM being tested or been tested? I think that there are still some that are being tested, and that goes back to the idea of we have really had to scramble. I will tell you that as doing our job, we have had a hard time making sure that we could find enough testing medium and testing availability for these people. And our whole community has really banded together to get this done because we knew how important it was. So I can tell you that on one day, 2 or 3 days ago, we tested, I want to say 21 patients. I know there was one day we did 40. And I know that there are 75 more that have been tested that results are pending. So there are a lot of people being tested. And then we really don't know because I've been told that there were several that went and had private testing done on their own. So.
And then just wanted to confirm, on Friday you had said PAM had decided that the best course of action would be to keep patients there. For the patients who are sick, is that still the course of action? To keep them at PAM North as opposed to moving them to another facility? Well,
the question was to keep them there. And I had a good conversation this morning. Actually, Brittany and I, the epidemiologist, had a nice conversation with their chief medical officer as well as the chief executive officer. And they have basically moved all the patients into one area. And that area is being very closely watched. Only certain people go in and out. Everyone going in and out of there has full protective equipment on. And basically we've formed a cohort out there where we know that the disease is. Those patients are being cared for. They're being cared for very nicely, and I can tell you that as of today, they all seem to be doing okay.
And then, God forbid, we should get to this point, but does a long-term care hospital have the ability to provide intensive care that more seriously ill patients might need?
This facility does have an ICU type environment that they can provide a higher level of care. And when it comes down to it, we're not just going to keep somebody out there just to be safe. If one of those patients needs a higher level of care that could be achieved at one of our hospitals, then we will gown the paramedics up and we will transfer them to that facility and we will provide that care.
And then on Friday, you had mentioned kind of the main shortage in terms of testing was the viral transport mediums.
Right.
Is that still what we're missing? Are there other supplies that are in short supply?
Somebody must have tipped you off. The question was, are there other things that we're short of? And it's not just the fact, it's the whole collection process, basically. We're having trouble getting enough swabs, which are the little things that go up your nose. So we're having trouble finding those, as well as the medium. And then once that's done, we still have the problem of the testing capability of the nationwide labs who are doing these tests. So it's kind of a whole thing that we're looking at, and we're doing the best we can. Hopefully the rapid testing will come out quickly, and I've been told that we're going to get some of that equipment in Texas. I don't have those details yet, but we're working very hard to get that. The ultimate goal would be to get this equipment to where we can test somebody in 15 minutes and say yes or no, and this is what we have to do, and that's our goal.
At this point, before that rapid testing becomes available, in terms of supplies, do we turn to the state? Do we turn to the federal government? Who do we, seek out support from?
The question is, where do we turn if we can't find local testing? It's very hard, because turning to the state right now, we've already done that. The state has already turned to the federal government. The federal government has turned to all the private sector. So everybody is looking to everyone for help. This is a nationwide, and I would say a worldwide shortage. This is something we've never seen before, certainly not of this type of virus, and certainly not of this magnitude. So we're doing the best we can with what we have, and that's pretty much all we can do.
Dr. McNeil, I want to go back to the mask really fast. The shelf life of the mask, so the ones that like we're wearing right now, how often should they be changed out?
The Centers for Disease Control has set guidelines on that, and those have just been released. I will let you know exactly what those guidelines are. I know that in the emergency department, we are using the simple mask as well as the N95 mask, and I have a brown paper bag because what we do to extend the life of these things is we use the mask, and then we take it and we put it inside our brown paper bag, and we close the bag, and we keep it and use it again. Before this, I would routinely use that mask, take it off, throw it in the trash can, and go on down the road. But we don't have that luxury anymore. So we are repeating use. There's been some talk about being able to clean them in certain ways. I've heard about UV light being able to clean them. There's a lot of information going out there because it's necessity. And the necessity is that we use these masks again. So yes, we are reusing them.
Dr. McNeil, just one more question on Pam. Are there other folks who we would perhaps like to test if we had the ability to, but just can't because of supplies, other persons under investigation that in an ideal world would be on that testing list?
The question is, are there people that we're not able to test from Pam because we don't have the capability? That we're not at that point. We have been able to test everyone, and everyone from all the facilities are going to be tested. And we're also reaching out to patients that have been there during this time that are going to be tested as well. We're also being very careful about that healthcare providers moving back between facilities. A lot of these healthcare workers work at multiple facilities. So that's all part of the epidemiological studies that are being done to make sure that we identify these patients. We don't want a vector going back from facility to facility with this disease, so we're being very careful about that. But the answer to your question is we have not gotten to the point to where we cannot test them.
And then for nursing homes, for other long-term care hospitals, Pam operates 4 in the area. I mean, what can they be doing to best protect their patients and their employees?
The same thing we've been doing, social distancing, good sanitary thing. Everybody is working hard, and everybody understands now what we have to do to slow or prevent the transmission of this disease. Nobody wants us to get into a nursing home because they're very vulnerable patients there. It's obvious. So we're being very careful about that. We're watching how these patients are being moved. We're going back historically and looking where they've been moved, and we're just trying to do the best we can to limit the transmission. It's a very daunting task, but the epidemiology people are truly working day and night to get it done.
And then just 2 quick numbers questions. Do we know how many of our current count are in the hospital and how many are in critical condition?
I can tell you that as far as who's been in the hospital, I know that one of the hospitals has 2 patients in it and the other probably has a couple. There are still, I know, 2 people that are on ventilators and 1 person that's on another type of respiratory assistance. So there are several patients that are still critical. But I can tell you this, that I spoke to one of the pulmonologists this morning, and 2 of the very critical patients are actually improving. So I have good news on that. One of them is still very sick.
And then, you had mentioned the recommendation is for anybody who leaves their house to wear a mask. What if you are just going for a walk and keeping a safe distance? Is it still best practices to be wearing a mask?
The CDC has said that basically anytime you're going to be around other people, remember that this is just for in a situation where if you get in a situation where someone's too close to you. Now, nothing replaces social distancing. So I think if you're going to go run and you're going to be by yourself, you would probably be pretty safe without the mask, and it may be kind of hard to run and breathe with the mask on. So there is that. It's kind of a common sense thing to think about that. What if situations of what about this or what about that? That's going to have to go back to people just thinking and trying to protect themselves and protect the community.
Are there any other questions? If not, I'll turn it back over to Ashley, who will come back in to wrap things up. Thank you.
Thank you very much.
Thank you all for tuning in today. Once again, our website is victoriatxoem.org, and you can call our COVID hotline at 361-580-5796. And just in case you're just now tuning in, or maybe you missed it in the beginning or the middle of today's press briefing, as of 2:30 p.m. today, we have 9 new cases, 4 of which were from Pam North. Total cases in Victoria County is 50. Suspected community transmission is 9. Those who have recovered, 6. And that leaves us with total active case count of 43. For anyone with unmet needs, you can contact 211. And the Texas Health and Human Services statewide mental health support line is available 24/7 at 833-986-1919. Once again, I want to remind you all to please respond to the 2020 census, as it does provide federal funding for our Victoria community. You can do so by visiting my2020census.gov. I thank you all again for your time, and we will see you again same time, same place tomorrow. Have a great rest of your day.